Our top focus at this hour: to combat the soaring coronavirus infections, the French government has brought forward its nighttime curfew by 2 hours in 15 regions. The curfew will now be beginning at 6 p.m. rather than 8 p.m. in 15 of France's 101 regions, and areas affected by the switch from Saturday include Les Alpes, that is Maritimes, where the Mediterranean city of Nice is located. The other areas are concentrated in the east of the country, and Paris has been spared the additional restriction for now. The measure has been urged by mayors who were increasingly concerned about local health systems being overburdened by an influx of new cases. Pushing the reopening date for a second time, theatres, cinemas and concert halls would not be able to reopen from January 7th. The French government will assess the impact of this earlier curfew on these 15 regions in a week's time, and if the situation were to deteriorate further, officials say an incremental measure could go as far as a lockdown. With cases crossing 2,620,000, France now has the highest COVID-19 case count in Western Europe, and it is also the fifth worst hit nation in the world. The death toll is at 64,632. Meanwhile, the pace of France's campaign to vaccinate people against COVID-19 is also notably slow. It has seen just 332 people vaccinated in the country till Wednesday, compared with more than 130,000 people in Germany who have been vaccinated already. For more about the development of the situation in France, we are being joined by Stéphane Devry, a journalist from Paris. Stéphane, welcome to WION World is One. Tell us about this new curfew that is set to be enforced in France. We've heard cases surging in different regions. Tell us more about the situation.
Yes, indeed. From the beginning of the pandemic, actually, the east of the country has seen far more cases than the rest of France. And that's also the case now. The virus is spreading much faster in mostly the eastern parts, so the part that borders Germany, than in the rest of the country. So that's the reason why the government has decided to put in a curfew as per tonight at 6 p.m. local time. It is now 8 p.m. in the whole of the country, but now it has been put forward to prevent people having social lives. So to make sure that they stay at home, that they're not going to see any friends, in order to hopefully stop the spread of the virus.
Right, Stéphane, we've also heard about acts of vandalism in some areas, mostly Strasbourg, on New Year's Eve. Tell us more about those incidents.
Yes, it's traditional in France to set fire on cars, for instance, on New Year's night. Usually on New Year's Eve, traditionally there are over 1,000 cars that have been set on fire, especially also in Strasbourg, but also in other large cities. Now this New Year's Eve, of course, the people had to stay inside. There's a curfew. People had to stay inside after 8 p.m. So relatively few people were on the streets, but those who were obviously partied, and some of them even set cars on fire, but far less than previous years, of course, because there were less people on the streets. And then in Brittany, in the west of the country, there was an illegal party, a rave party, in an abandoned airport hangar with over 2,000 people, and it took the police 2 days to finish that party. It actually just stopped a couple of hours ago, and people, many of them were arrested or got a fine because they were illegally there, of course. So there have been some incidents, but because of the curfew, far less incidents at New Year's Eve this year than traditionally in France.
Right. My final question, Stéphane, how is the healthcare system in France coping with the surge in cases? And why has France been slow in comparison to other European countries in administering vaccines to its population?
Well, yes, you have to understand that the number of cases in France is one of the highest in Western Europe. You already mentioned that. And to give you an idea, it is 6 or 7 times as high as India when you relate it to the size of the population. And the number of deaths is even 9 times the number of deaths in India. So it is a huge, it's far more massive than in India, and the healthcare system in France is already in normal times pretty overstretched. So there was simply not enough capacity, and that's also the reason why the government decided to install the curfew, to make sure that people will not go to the hospital, to make sure that the virus doesn't spread. The system has been under stress for many, many years. People are underpaid, investments are low, facilities are old-fashioned, so that's a very serious problem. This year, the government has said that it will invest massively in healthcare, but so far, not really. There has been no real improvement. And why they are so slow? Well, the European countries, the 27 member states of the European Union, got the green light last Saturday, so exactly a week ago. Many of them started because they already had preparations in place, but not France. France started very discreetly, actually. And there's still one country that hasn't started at all, and that's the Netherlands,
right.
Also because of logistic reasons. So there's now, of course, a political crisis in France with the question, why are we so slow and our German neighbors are so quick?
Right. All right, Stefan, thank you so much for joining us on this broadcast and for all your insights. WION World is now available in your country. Download the app now and get all the news updates on the move.